This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning and welcome into the program. This is Mon Health Talk. I'm Dave Wilson. Got a couple of guests joining us this morning as we will get into the topic of colorectal cancer and Colorectal Cancer Awareness Month. Joining us on the program, an old friend, I won't say an old friend of the show, but friend of the show, Dr. Qazi. Dr. Qazi, good morning.
Good morning, David. I'm glad to be here.
Didn't want to call you an old friend of the show, just a friend of the show. Glad to have you here. And we also have Dr. Nasr on this morning. Dr. Nasr, good morning.
Good morning. Good morning. Glad to be with you.
Guys, I'm glad you could take a couple of minutes. And you guys know I have to make you talk about yourself just for a little bit, no matter how many times you guys have joined us on the program. So, Dr. Qazi, I'll kick it to you first. Just remind folks a little bit about your background.
Sure. So I was born and raised in the Charleston area. My parents still live there in Cross Lanes, West Virginia. Went to Nitro High School. Did my undergraduate training and research. Started research at Case Western Reserve in Cleveland, and then came back to WU and did all my medical training here. And then I joined Mon Health almost 5 years ago now, and just loved it ever since.
And Dr. Nasr, a little bit about your background.
So I'm an advanced gastroenterologist. I do all types of endoscopy procedures. I was trained at the University of Pittsburgh, and I've been working in the West Virginia area since 2015. I just joined. I'm proud to have joined Mon Health around a couple of weeks ago, and I'm glad to be with you and to provide the best care we can to the population of West Virginia.
Well, Dr. Nasr, what drew you to Mon Health? What interested you about this area?
The Mon Health area, the thing that drew me about it is that it's a top-notch facility that provides the best care possible for the community and for the population of West Virginia, providing the best the advanced technology and with the best doctors available and the most skillful doctors. So we work as a team to enhance the health of the whole population of West Virginia and the surrounding areas.
All right, Dr. Qazi, I mentioned we were going to get into the topic of colorectal cancer. On the range, I guess all cancers are bad, obviously, but on the range of cancers, how prevalent is this, especially here in West Virginia?
Well, I mean, in general, nationally, colorectal cancer is like the third most common cancer, excluding skin cancers in men and women. And actually, colorectal cancer is the second leading cause of deaths in West Virginia. West Virginia actually has the second highest rate, I think from the last study I looked at, just barely behind Kentucky in actual cases per 100,000. So it is a very prevalent problem here in West Virginia, and one that we really need to really cut down the numbers, and especially for this very preventable cancer. With proper screening, it really is a preventable cancer.
What are the easiest ways to prevent the cancer? I guess it comes down to screenings.
Yeah, definitely. I mean, screening is really the key in getting ahead of this cancer. This is one of, like I said, what I mean is a preventable cancer is that we see the early signs of this on screening tests, and there's a whole host of screening tests. And Dr. Nasr is a expert in doing the endoscopies for this. Just a personal side note, he's the first person I went to when I had an issue, and I had him to scope me. So I'm a little bit biased about Dr. Nasr. I think he's probably one of the best gastroenterologists I've ever met. So he's absolutely amazing. But really, the work that needs to be done is that patients need to talk to their PCPs, and there's a whole range of screening tests for colorectal cancer. The gold standard is a colonoscopy, obviously, but there are a lot of people who have issues with getting them done. Recently, the guidelines changed because of the fact that colorectal cancer is increasing in the population at a younger age. And in the younger than 50 population is increasing about 1 to 2% per year. And that's been concerning because I've been seeing here in Morgantown and in my office in Weston, there's a lot of younger patients coming in. And so the screening guidelines changed to 45. I just turned 45, so I had my colonoscopy done here at Mon, and it was a great experience, very easy to do. But there are other tests, other kind of screening tests. And Dr. Nasr, if you want to talk about those as well. But there are a host of things to be done, for people to screen them, and just need to find the right test for the right person.
All right, Dr. Nasr, after that first-person endorsement there from Dr. Qazi, let's talk just for a moment. I think everyone is fairly familiar with what the colonoscopy is, but
Yes.
I know a lot of people, especially if you've never had one or you're going in for your first one, there could be a lot of apprehension there. So can you just walk us through that procedure, what it's like for the patient?
Yes, definitely. So like Dr. Qazi said, the most important step in managing colon cancer is preventing colon cancer. And colonoscopies can do that in two ways. First of all, they detect polyps, which are the precancerous lesions that usually lead to the development of cancer. And when we see these polyps during a colonoscopy, we remove them on the spot. So that prevents colon cancer. The second thing is if colon cancer is detected early on, the earlier the stage it's found, the more likelihood that the patient would be cured and have a longer survival. So that's where the importance of a colonoscopy comes in. Now, as you said, usually people are apprehensive when they hear about the colonoscopy. It's a procedure that many people have negative connotations about. But the truth is that colonoscopy is a pretty simple procedure. What it entails taking a prep to clean your colon out the day before the procedure. Then the day of the procedure, you present to our endoscopy unit where you are seen by a group of very skillful and nice nurses. They prepare you, put an IV in, an anesthesiologist is available, you get sedation, and we do the procedure, which usually lasts anywhere between 10 to 15 minutes. Patients are usually unaware of the procedure going on. They wake up and the procedure is done. If the procedure is normal and people don't have any risk factors for colon cancer, like a family history or prior history of polyps, then we take another look in 10 years. If somebody has a first-degree relative in their family, like a mother, father, brother, or sister that have colon cancer, or if they've had polyps themselves before, then we usually take a look in another 5 years because we just want to make sure that if any polyps develop in this interval, that they are removed to prevent the development of colon cancer. So in general, a colonoscopy entails a day of preparation where you take the colonic prep to cleanse out, and then a day where you come to the hospital, get sedated. The whole trip will take around 2 hours from the moment you come to the hospital to the moment you leave after recovering from the anesthesia and the surgery. And as I said, it's a pretty simple procedure that has a very low risk of complications and has a very high potential to prevent one of the most common cancers in the United States and the world.
Dr. Nasr, are there other screening options, or in addition to the colonoscopy, are there other screenings available?
Yes, that's a very good question. There are other options for people who cannot get the colonoscopy or are apprehensive. Two of the most common ones we use, one of them is called the fecal occult blood testing, where you check your stools for microscopic blood that you can't see, and you do it 3 times and send it to the lab. The other would be a stool test, which is called Cologuard, which looks at DNA malformations within the stool that put people at high risk to develop polyps or cancers. In the setting of one of these tests, either the stool blood test or the stool DNA test coming out positive, then a colonoscopy has to be done. So if you intend on getting one of the other screening tests, which is a stool blood test or a stool DNA test, which are both stool tests, but at that point in time, if you have to know that if they turn out to be positive, that is showing that there is a risk of a polyp or cancer, then the next step should be a colonoscopy.
We are visiting with Dr. Nasr and Dr. Qazi this morning on Mon Health Talk. We've got to take a quick break. We'll continue our conversation right after this on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guests this morning, Dr. Nasr and Dr. Qazi, we're talking about screenings and Colorectal Cancer Awareness Month. And Dr. Qazi, are there symptoms or signs that a patient may have an issue and need to get that checked out?
Yeah, I think like one of the most common symptoms that and it's amazing people do sometimes ignore these symptoms, but they just figure that that it's a passing problem like hemorrhoids or something. But usually obviously anytime you have blood in your stool, either bright red or dark oxidized blood in the stool, that's always a concern that should be checked out. Change in bowel habits, new onset pain, unexplained weight loss, stools that are narrower than normal, just changes in your bowel habits in general that really don't make a lot of sense, especially with any kind of blood or weight loss. Those are really kind of red flag symptoms, and a lot of these like screening tests actually are looking for that blood as a major cause or a major symptom of maybe a colon cancer. And we think that whenever we see blood, the first thing you should think about is colon cancer. Second thing you should think about is colon cancer. Maybe the third thing you think about is colon cancer. So, blood in the stool is one of our biggest signs. But all these other changes in bowel habits and smaller than normal stools, those are kind of big kind of risk factors or symptoms to look out for.
Dr. Qazi, I've heard folks say, know your numbers, and when you get your blood work and the numbers will come back and there'll be normal ranges. Is this something that if there are signs of colon cancer that this is a very technical term, your numbers will be out of whack, that is something that will show up?
Yeah, if the bleeding is significant enough, a lot of people will show up with an anemia. Usually it's an iron deficiency anemia because they're losing that blood and the iron with it. If they lose it fast enough, obviously they develop this iron deficiency anemia. And again, that's for someone relatively healthy with no other problems. Again, the first thing we think about is bleeding in the GI tract, and that's where we get Dr. Nasr involved to try to find that bleeding. Usually that's the standard of care is to try to figure out where that's coming from.
And Dr. Nasr, what are you looking for when you're scoping someone? When you're looking, when you've got the camera in there, what are you looking for as signs of concern or when you're trying to develop a treatment plan?
Yeah, so usually with a colonoscopy, the things we look for are number one, polyps, which are the small nodules that are the precursors to cancer of the colon. Those are usually removable. In general, studies have shown that the time it takes from a polyp to develop to colon cancer is 10 years. And that's why when somebody has a normal colonoscopy, we say repeat it in 10 years. That's where the 10 years comes from. Now, if somebody is a high risk for colon cancer, so let's say somebody is coming with symptoms, like Dr. Qazi was saying, they have anemia, they have blood in their stool, their stools changed in size, they're what we call pencil thin stools, so they're becoming like a pencil, and for example, they have a family history of colon cancer, then at that point in time, we are looking to see if there's any mass development inside the cancer, inside the colon, which would be indicative of cancer. If we do find that, then at that point, what we do is we take biopsies and send them to the pathologist to confirm. And if there's confirmation of colon cancer, that would be followed by staging tests, which usually are CT scans, to make sure that the cancer is confined to the colon or spread elsewhere. Again, the earlier colon cancer is detected, the earlier the stage is. And if the stage we detected at an earlier stage, the survival and potential of cure is much higher than if it's detected at a later stage. That's why it's important to get your colonoscopies or other screening tests on time because, as we said, and we'll reiterate this again, this is extremely important. Doing a screening test, number one, will detect polyps, and if we see polyps, we can take them out on a colonoscopy, which would prevent the development of colon cancer. And the second thing is, if colon cancer is detected, then at that point in time, it will be detected at an earlier stage. So it's never too late to get a screening test or a colonoscopy.
So, Dr. Qazi, if the colon cancer is caught early, like Dr. Nasr was talking about, what treatment options are available?
So there's definitely a wide plethora of options for treatment. Sometimes even if they're very, very early stage, like just on the mucosal surface, specialists like Dr. Nasr can even sometimes take them out, and that's all that's needed. For any of the invasive colon cancers, again, usually surgeries are number one modality for treatment. There's a lot of thought and a lot of studies and a lot of science has gone into the actual treatment for each stage of colon cancer, it really is a multidisciplinary approach. With the surgeons, the radiation oncologists, and myself to figure out what is the best approach for that person. And here, we use the National Comprehensive Cancer Network guidelines for treatment, and those are the compilation of the best type of treatments based on the latest studies. And those do change it. Fortunately, we're getting to the point in cancer care that we're actually using what we call precision medicine. We're being, personalizing that care for each patient for the biology of their cancer, and that really helps us be able to improve survival when we do detect disease. And going forward, that's going to be how hopefully we actually increase the survival of people who do get diagnosed with colon cancer early stage, mid stage, or late stage.
Our guests this morning, Dr. Nasr and Dr. Qazi. Guys, thank you so much for spending some time. Good conversation. We could probably go for another 30 minutes here this morning, but as we say, we've run plumb out of time this morning. Thank you so much, guys.
Thank you so much,
Dave, as always.
Thank you very much.